And a typical workday includes seeing 30 to 40 patients a day, and the salary ranges from $100,000 to $500,000, which is a great salary for working from like 9 to 5 and not being on call. So for this class, it's a collegiate level course where we get to choose a mentor that's something that we maybe potentially want to be later, or just something for fun that we want to get an experience with, and we mentor them for 2 hours a week. And throughout the course of this class, you must complete an online portfolio showcasing the assignments that you've done. So I'm going to kind of go into that. Okay, so this is my online portfolio, and I don't know why this isn't working. 1 second. So this is my portfolio, and it shows you the purpose of this website. Here's that picture of me and my mentor. We had to write a paper on what we're doing our project over, so this final presentation. And every week when we document our 2 mentor hours, we have to write a journal of what we did in the office. So this kind of shows you every week after this is all the stuff that I did. On some of them I got to see her freeze warts, prescribe medicine, cut out cysts, a bunch of different stuff. Some of our assignments, we had to do interviews with different people to see, to get a real life experience on what this is like. We had to do a survey and conduct how much your friends and peers around you know about your topic. So I'm going to touch more on that later, but here's kind of a preview to my survey. And then we had cute invitations. So that's kind of everything we've done this semester. So it's all focused around this one presentation. I chose this project topic because I'm very interested in dermatology and the skin, and I think cysts are really cool, and I would like to inform people on how to take better care of their skin and make them feel more confident about it. So a cyst is a sac-like pocket of tissue filled with dead skin, pus, and fluid, and it can grow on any body part. It can appear as a bump or feel like a lump under the skin, and usually it's not painful, but if it's infected, pushing on a nerve, or it ruptures, it can become painful, so you should go check it out. But usually it's not a big deal, and it's just if it bothers you that you should get it checked out. But it can be caused by infections, diseases, chronic inflammation, or blockages in the skin. You can't really prevent most cysts, but you can prevent the things that cause them. So you can prevent certain infections by eating right and living a healthy lifestyle, but you can't prevent the actual cyst. So there are hundreds of different types of cysts, including epidermoid or sebaceous cysts, which is what I'm mainly going to focus on, and that's the one that you see if you watch any of those Dr. Pimple Popper videos where the pus and the yellow sebum comes out. There are breast cysts, which are fluid-filled cysts within the breast. You should check those for skin cancer because it could, or not skin cancer, breast cancer, because it could be breast cancer or it could just be a cyst. And then ganglion cysts are soft tissue buildup around any joint in the body. These are really common with athletes. If you're constantly pushing on a certain part of your body, you can develop that around a joint. Ovarian cysts, which is accumulation of liquid around an ovary, and these these can cause one to need a hysterectomy if it's blocking your system. A Baker cyst, which is swelling behind the knee in the synovial bursa, or a sinus cyst, which is abnormal tissue growth around the sinuses. And again, there are a million different types of cysts. These are just some of them. But I'm focusing on the epidermoid and sebaceous cyst because I actually got to see one of these being removed. And it forms from sebaceous glands that secrete oil that lubricates the hair and the skin. So it's really common to get these if you're a teenager or you have a problem with your skin that overproduces oil. Symptoms include a blackhead blocking the central opening of the cyst, pus that drains from the cyst, or redness and swelling if infected or ruptured. So you only really need to see a doctor if it's constantly irritating you, if it grows really fast, or if it becomes painful. And this is what it looks like. This is like a snapshot of underneath your skin, and this is the top layer of your skin where it's just constantly shedding. And what happens is a piece of your skin that's supposed to be shedding doesn't, and then it gets stuck below your epidermis, which is the top layer of skin, and then it collects around here and just multiplies and forms a big sac under your skin. So like I said, it's a layer that's constantly shedding. When they get past and do not shed, they multiply and form epidermoid cysts. They can be caused by a damaged hair follicle or oil gland, because in this picture, do you see like the hair follicle? That's your hair follicle, and then if that's damaged or a piece of it gets broken off, it can get trapped in here and mix with the oil glands and cause the cyst. One is more susceptible to developing these if they have already gone through puberty, because like I said, your hormones are going crazy, there's all this oil production, and your body can't really control it. You have a history of acne, or if you've injured the skin in that area, because then it's unable to shed and can get stuck below the layers. So for treatment options, right now you can see all of these pimple popping cysts and like that stuff on Dr. Pimple Popper, but you're actually not supposed to pop it on your own because it can become infected. So either go see like the Minute Clinic, general doctor, or a dermatologist would be best. But doctors can use a carbon dioxide laser to vaporize the cyst. They can give cortisone injections to remove inflammation. They can make a small incision and squeeze out the contents, which is what we see. But most of the time that reappears because they try squeezing it out and they don't get all of it, and then a little piece is stuck, and just how it formed, it just stays there and multiplies and causes another one. So the best option is to actually surgically remove the cyst, which is what I saw, and you go in and you cut out all of it and you get to the base of it and then you just completely take it out. So there's no chance of it coming back because it can be like a painful process. So for the surgery process, this is pictures that I actually took. So you'll draw an ellipse around the cyst to ensure you're cutting in the correct spot. So you can see her little dots around. That was a big cyst on a person's back, like probably around this big. Here's all the surgical tools that they use to keep everything sterile. You numb the area where the cyst is with local anesthesia. She usually uses lidocaine, so the patient isn't asleep during the removal process. They're just numbed. But you make sure the area is clean and cover the skin around it with sterile drapes, so in that picture. She uses a scalpel to gently cut through the first layer of the skin, and she continues cutting until there is a separation of the cyst from the skin. She presses the skin around it to push it up and locate the roof of the cyst, so like kind of as how you would pop it, to push down on it so you can see where the bottom of it is, so you get all of it. And then using forceps, which are basically just tweezers, to lift up the ellipse of the skin with the cyst attached and separate the root of the cyst from the underlying tissue. So, and then after that, she'll close the skin with non-absorbable sutures, and then clean the wound with saline solution and dry with gauze. It's usually like a 30 to 45 minute process depending on how big it is. That's how big that's how long it took with a really big one, so I'm sure it could be a smaller process with. Okay, so with this class we have to do artifacts. We had to collect 10 things from our mentor or 10 things that we did throughout the course, like a survey or brochure. So I use this as one of my artifacts, and here's the survey that I was talking about, and this graph up here, it says what is a cyst, and as you can see, almost all of the people knew what it was. And then for have you ever been to a dermatologist? Out of my friends and family, most people had. Do you need to get a cyst removed? Most people said yes, but actually you don't unless it's painful or infected. But those are just some of the questions I asked, and it was really cool getting to see like how familiar the people were around me with dermatology and cysts, and anyone could take the survey over 13, male or female. So that was really helpful. And then here are some more artifacts I got. That's a sample that she gave me for blackheads. Here's sketches of her cyst, and this was her showing me before she removed it. It was the process of, here's the dead skin cells stuck underneath your skin. Here's where she's going to go in and take it out, and then there's nothing left. And then this was the video contract form for the video y'all are going to see of her removing the cyst. So here's the video. This might gross y'all out, but sorry. So you can see her like picking at it, trying to get around the skin. She's using her scalpel. She's gently cutting so she doesn't harm any other part. You can see how big it actually is. Like, just with the bump earlier, you couldn't really tell, but it's a really big cyst, and then after she's going to pull it apart and show the contents in it. But you can see that it's just a hard sac filled with stuff. And she gets to the root, like the process I was talking about. And that's the whole cyst. And you can see like it's just dead skin inside of it and pus. But it's just a sac around it. So this experience gave me an insight on what the dermatology world was actually like in the private medical practice setting. I learned about a wide variety of skin conditions and how to treat them. I saw a lot of teenagers coming in with problems for acne. I saw her talking to a lot of people about freezing warts. What's weird to me is they use liquid nitrogen for almost everything they do, which like you wouldn't expect because it's like a really cheap way of treating something, but they can treat almost, I'd say like she uses it for 50% of her patients, whether it's removing warts, removing sunspots, moles, like vein treatments where you have like too many veins showing. So it's really common for her to use, and it just blisters up the skin and then falls off. So if you have like an unwanted freckle or mole somewhere on your skin, it's super easy to use. I also got to see her do fun stuff like Botox, and I learned cool stuff about it. Like she said that if you really want to never develop wrinkles, you should start using Botox when you turn 26, and then because Botox it's basically like you're cutting the proteins and you're paralyzing the muscle. So your skin muscles here are not allowed to move. So if you do it when you're that young and you just keep up with it, it wears off after 3 months. After 3 months, you go in and you get it again, and you keep doing it for a certain